We brought our daughter Aubrey to have her tongue and her lip corrected, and actually had Dr. Baxter look at our 3-year-old who's been through speech therapy, and she did have a posterior tongue tie, and we had that corrected, and her speech has greatly improved within moments of the surgery and then throughout this last week. We've also noticed a huge improvement in her sleep and her behavior. And then Aubrey is also nursing significantly better than she was last week.
Before the procedure, he wasn't really talking too much, maybe 10, 15 words. Not eating too much. Sleeping was, not too good. And then after the procedure, I think we're 3 months out, he's talking more, eating more, sleeping through the night, and it's made such a big difference.
My son is 4 years old, and we just discovered he had a tongue tie. He had it about 10 days ago, and since then he's definitely had a significant improvement in speech. His teacher at school has commented about how much more she can understand him, and his sleep is definitely better. He used to come into my bed every morning between 4 and 6, and now he's sleeping in his room at night until about 7:30, 8 o'clock on school days earlier, because he had to get up earlier. But I am incredibly impressed and grateful for the services we're receiving here.
2.5. She had a procedure done just a few weeks ago, and we've noticed her sleeping has improved. She doesn't have the night terrors as she was before, and right away the snoring has stopped. And so she's gibbering a lot more with speech, and that's coming along better. And we've seen a lot of improvement, so we're happy. The night terrors have stopped. She used to just move quickly and cry out in the middle of the night, and she hasn't been doing that.
Hi, my name is Michaela Rayfield, and my 2 children, who are 5 and 1 year old, recently had their tongues clipped, and he also had his lip clipped. And immediately within the first week, their sleep has just greatly improved. He was waking up 3 to 4 times a night, and we are down to 1 time a night. They are snoring less, they're moving around less, they were very just restless. And that has, just within a week, improved drastically. And my daughter's speech has started to improve. She was a lot of baby talk, and now we are able to stop her and teach her the correct sounds, and she's able to imitate them, and her speech is improving. So we are very happy with Dr. Baxter.
So before posterior tongue tie, she had trouble sleeping. Very restless at night, up and down multiple times. Always would breathe with her mouth open, snoring. And since the surgery, which was a week today, sleeping much better. The first 2 or 3 nights she slept with me, and I honestly was afraid she was dead because I could not even hear her breathing. Noticed that her mouth breathing during the day and at night has completely does not exist. I mean, she's breathing out of her nose. No snoring. Speech has improved some. It's clearer than what it was. We will still need work on certain letters. And the hyperactivity, definitely less. She's a lot more chill and easy to deal with, for sure.
So Harper had her tonsils out in July, and we were in the hopes that that would help her sleep and her hyperactivity type issues, and it did a little bit. It helped with the snoring, but she was still having restless nights. The sheets were all messed up in the bed. She would be sideways in the bed, never felt rested the next morning, and so we had the tongue tie procedure, and that night we even noticed a difference. She was sleeping more soundly. She did not move throughout the night. She was not tossing and turning, kicking. There was no snoring whatsoever. She stayed in one position, head on the pillow the entire night, and it has been that way since the procedure has been done.
This is my son Parker. He's 3.5. We found out about his tongue tie a year ago, so he was 2.5 years old. We went for a speech evaluation because of having speech delays, and instantly the speech therapist noticed that he didn't have much use of his tongue. That same week, Dr. Baxter had an appointment for us, so we came in. We had the tongue tie released, and a year later, Parker is a different child. He is almost completely caught up on his speech, so there's pretty much no more delay. He has caught up on everything he had to say during that missed time, and we are so glad that developmentally he has caught right back up to speed. But having the tongue tie released was completely implemental in why he's able to get caught back up. So we're so thankful that the speech therapist noticed the tongue tie and are just grateful that we found it when we did, and certainly would have taken care of it sooner had we known.
Hey, I have a child. His name is Aiden Ellison. He's age 9. He recently just discovered that he had a tongue tie, and before his tongue tie he had trouble eating, he had trouble sleeping, he was agitated all the time. Food was a problem because he would just pack his mouth and look like a chipmunk, or certain foods were hard for him to swallow, and he would just always gag it up. And then it was the coming sleeping, he was just real agitated, and he would always be up late at night, and that's him in the background, and then he would just never sleep like soundly. So it was always a struggle for us, and I thought, well, he'll never sleep great, and he always opened his mouth when he's sleeping, he grinded his teeth, and he was just very irritable when he wouldn't get enough sleep. So coming to Dr. Baxter, you know, he recognized Aiden had a tongue tie, and that was a shocker to me because I didn't know what a tongue tie was. But I was like skeptical at first, like, well, how could that really help him? But since having the procedure done, Aiden has done tremendous. The healing process was very quickly, the procedure was very quickly. We had ice cream right after, so, and he was laughing and giggling, so everything worked out great. His behavior at school has been great. The teachers have noticed how tremendous his behavior has been, just a 360. He's gone from an irritable child who would cry and scream to now he's just happy and laughing, and he's waking up better, he's sleeping more soundly. He no longer sleeps with his mouth open. He never grinds his teeth anymore. He still gets mad and grinches his teeth as autistic children do. But, you know, just the nice, peaceful sleeping through the night. Doesn't have to wake me up 3 o'clock in the morning. But just him sleeping soundly and being happy has been tremendous to us. As far as speech goes, he has been nonverbal for 9 years. I did not expect him to go, "Hey Mom," after the procedure, but he has been babbling, making great like new sounds. He did say "Mama," so I'm looking forward to just the progress that he's going to be making because of this procedure. So I wanted to thank Dr. Baxter and his team for recognizing this and helping Aiden, and I can't wait to send Dr. Baxter a video one day of Aiden just completely saying hi and bye and all that. So that's the goal, but so far right now I'm pleased, and I recommend this to anybody who has a child who's kind of contemplating whether they want to do it or not. It's worth it. It's no different than spending the money to do a speech therapy session. So I highly recommend it for your child, as far as if they're not sleeping great, if they're not, you know, their behavior is kind of irritable, maybe that's because of the sleeping and eating, and I just recommend it.